Thank you, Honorable Speaker. HIV and AIDS and TB remains a key health challenge, particularly for our country, which still carries one of the highest burden of the epidemic in the world. We are, however, encouraged by the strides we have made in our national response to end HIV and AIDS and TB as a public health threat by 2030. The implementation of our National Strategic Plan for HIV, TB, and STIs 2017 to 2022 has had a positive impact in combating HIV and AIDS in the last 5 years. To date, South Africa has the largest antiretroviral treatment in the whole world. That has resulted in a significant increase in the people who are living long. As at August 2022, 90% of the estimated number of people living with HIV, they know their status. And 76% of those people who know their status are on treatment. And 90% of those people who are on treatment have suppressed their viral loads. That means they can live long. Despite the progress we have attained to date, however, Honorable Speaker, we remain concerned with the high rates of HIV infections among young people, especially adolescent girls and young women. These new HIV infections occur in young people between the age of 15 and 24. And according to the Tembisa 4.3 model, in 2019, there were roughly 14,000 new infections in young males and 55,000 infections in young women. In this regard, the South African National AIDS Council launched a national youth HIV prevention strategy for South Africa in June 2022. As a 3-year youth HIV prevention campaign that focuses on the integration of key health and social services and youth development programs, social and behavioral change, communication, mobilization for increased access to and improved the quality of health products and services. The campaign's ultimate objective is to reduce by 40% the prevalence of HIV and sexually transmitted infections among South African youth, primarily those between the ages of 15 and 24, particularly among young women. We're also implementing a targeted social behavior change program, like You Only Live Once, which aims to provide a secure and a supportive environment in which young people can safely engage in conversation about HIV prevention. These conversation platforms allow young people to learn, share their challenges and perspectives, and receive assistance where required. I'm happy to have attended one of these sessions and listened to young people talking about this. The establishment of youth zones within our facilities have contributed to ensuring that we broaden access to services targeted at young people. Youth zones are dedicated spaces providing a suite of services to young people who visit our facilities to interact with health professionals. These services include, among others, reproductive health, safe sex, and risk information, HIV testing, treatment, as well as mental health, as well as substance abuse support. Despite South Africa being acknowledged internationally for its positioning and responsiveness to human rights, the National Strategic Plan admits that there are still large gaps to be overcome in the full implementation of the human rights agenda, particularly for key and vulnerable communities. In response to the disproportionately high prevalence of HIV among key and vulnerable population, SANAC has developed a national sensitization training which aims to reduce stigma and discrimination against those who are HIV positive or TB vulnerable. This is meant to make it easier for them to access justice and redress and foster an environment that upholds and protects their legal and human rights while preventing stigma and discrimination. In collaboration with our partners, this program has been rolled out in provinces to ensure that implementers are sensitized. In addition, explicit inclusion and support of needle and syringe services in the country's national strategic plan is another hugely important intervention that we've done as SANAC. The Global Fund 2018 baseline assessment indicated that people who inject drugs experience stigma and discrimination behavior from healthcare professionals, which creates a barrier to accessing HIV and TB treatment. For this reason, we focus a holistic support to ensure that people who inject drugs have access to services, given the fact that they are at high risk of HIV infections. Indeed, we have made strides. There has been some impediments in our efforts to reduce HIV infections in the whole country. This includes the COVID-19 pandemic that has hampered our ability to reach the 1990 UNAIDS target. This has happened especially during the hard lockdown periods. The interruption of service delivery, especially in KZN province, due to the April 2022 floods, has also had a negative impact on the entire country's performance in terms of HIV response, since you are aware, all of you, that KZN has the highest number of people living with HIV in the country. Gender-based violence and femicide also continues to be the main contributor to the increasing number of HIV cases. Together, we must fight this plague to promote healthy and cohesive communities. Stigma and discrimination at various levels of delivery in the health system also remain a major impediment, especially for key and vulnerable population, including people with disabilities, sex workers, and people who inject drugs, among others. The fight against HIV and AIDS can never be achieved without considerable effort, hard work, and dedication from all of us. It cannot be achieved without human agency and change in our behavior. It requires all of us to pause, think, reflect, in order to ensure that regardless of our station in life, regardless of our age, our class, our gender, we must all take responsibility for testing for HIV, testing for TB, and other ailments. It is for this reason that the SANAC, we've been holding a series of engagement with all civil society. We have interacted with interfaith leaders. We have interacted with traditional leaders, traditional healthcare practitioners, and the private sector in particular, in addressing the social barriers and structural barriers, social determinants that are causing the spread of HIV and AIDS. It is in working together, Honorable Speaker, that as a country, we can make the necessary contribution towards the global goal of ending HIV as a public health threat by 2030. I thank you, Honorable Speaker.